My name is Nikki Lamarche, and I'm the Outreach and Education Support Specialist at Kids Cancer Care. We're very excited to have you on today. I'm going to quickly go over who we are, more on education support programs at Kids Cancer Care, what the webinar series is all about, an introduction to our guest speaker, and then I'm going to pass it over to Dr. Fiona to speak to you all about the most recent research they have been involved in regarding COVID and cancer patients. So our mission at Kids Cancer Care is to provide families affected by childhood cancer a way to survive and thrive in body, mind, and spirit. What that means to us within the education support pillar is to provide you with new knowledge, strategies, current research, so you can thrive and become more wholesome as an individual and also as a parent. We have an entire education support stream that is available to support your child at diagnosis and beyond, their siblings and parents. We have a tutoring program to support the cancer patient and survivor siblings and alleviate some stress on parents by making sure it is free. We offer the Derek Windsor Memorial Scholarship to patients and survivors of childhood cancer to alleviate financial stress so teens can pursue post-secondary education. We just did a drive-through ceremony event in our office parking lot to give out scholarships to 12 well-deserving recipients. It was so fun. We offer a program called Cancer in the Classroom to help kids get back into the classroom safely and build awareness with their classmates and the school community about childhood cancer. And lastly, we have this webinar series to support families by providing speakers with expertise in certain areas to share their knowledge with you. Our Kids Cancer Care webinars are different. We only invite people and families within the Kids Cancer Care community to register, but we can bring in speakers from anywhere in the world. We make our webinar sessions small so that you have the opportunity to ask questions. We want to make some webinar sessions interactive and some where you can just sit back and listen, kind of like a podcast. Our webinar series will also be recorded and made available to you after the session on our Kids Cancer Care webpage, so there's no need for frantic note-taking. Our webinars take place in the spring and fall each year, so keep an eye out for emails as they approach because you must register for them. Consider our webinar series a way of having professionals share their expertise with our families and you being able to ask them questions at the end. If you ever want to know more about a certain topic or have ideas on who would be great at sharing their expertise in a certain field, let me know. Have questions that pop up or come to mind, you will be able to ask questions. We want you to post your questions in the chat box as they come to your mind. Then I will read them out to Dr. Fiona at a time that is best, likely at the end of the presentation as we are recording. After the session, we will ask for your feedback at the end of the session through email. Please take the time to answer this survey that will come into your email inbox by tomorrow. The answers you provide will give us great feedback to keep improving our sessions. A quick Zoom overview. We all know this by now because we've been on here for 1.5 years. We will keep everyone muted. Please click unmute if you have a response to a question from the speaker. Feel free to keep your video on so we know that you are there. It is never easy talking to black screens, but we totally understand if you keep your video off. Use the chat box for questions, and if we don't get around to all the questions, I will copy paste them into an email and be sure to answer them or have Fiona answer them. If kids or animals or significant others pop into the screen, we are okay with that. Now for an introduction to our guest speaker. Give us a wave, Fiona. So Fiona Schulte is an assistant professor in the Department of Oncology, Division of Psychosocial Oncology in the Cummings School of Medicine at the University of Calgary. She is also a registered psychologist in the Hematology, Oncology, and Transplant program at the Alberta Children's Hospital. Fiona's research is broadly interested in enhancing the patient and family experience for children, adolescents, and young adults diagnosed with cancer and improving the psychosocial late effects of childhood cancer survivors. Fiona is president of the Canadian Association of Psychosocial Oncology. She is also a member of a number of national and international committees focused on improving the care of pediatric and adolescent cancer patients, survivors, and their families, including the Children's Oncology Group Long-Term Follow-Up Guidelines Psychosocial Task Force. In addition to the SIOP Young Investigator Award, she has been recognized for her research by receiving the 2018 International Psycho-Oncology Society Hirumi Kawano New Investigator Award, and Calgary's Avenue Magazine Top 40 Under 40 in 2017. We hope you all enjoyed today's presentation. Grab a coffee, tea, or water, sit back and relax. Don't forget to post your questions in the chat box. I will now pass the camera over to Fiona. Welcome, Fiona.
Thank you so much, Nikki. Thank you for having me, and thank you to all of you for joining on this beautiful summer evening and for choosing to share your time with me as opposed to enjoying your time. Although I'm appreciating all the outside laptops. I think that's great. I'm going to share my screen here, and hopefully we did try this and it worked smoothly. So hopefully that happens again. Does that work? You just see the main page, Nikki?
Yeah, looking good.
Great. Okay. Now what has happened is I've lost my, okay. So I am in this setup now. I can't see the chat, but I'm not sure if this was designed to be more of a podcast style webinar or interactive. I would love this to be as interactive as possible. I have prepared some content for you. For those of you who participated with me in the fall. I'm looking forward to sharing some updated findings and data for you. But please, I would love if you have questions just to be guided by that as well. And I can do my best to try and answer the questions that you might have. So please feel free to interrupt, and just looking forward to being able to have a conversation with you. So I'm here this evening to talk to you about COVID-19 and childhood cancer. And I'm sure at this point in the pandemic, we are sick of hearing about COVID. But we have been conducting some research over the last 15 months to try and understand the experiences of COVID among our childhood cancer patients and survivors. As Nikki very kindly introduced me, so my name is Fiona. I'm very thrilled to see some familiar faces in the audience. I work at the Alberta Children's Hospital and also at the University of Calgary, where I have a research program. And all of my research is dedicated to understanding the experiences of children and their families who have been diagnosed with cancer. So today, I thought I would, what I would like to do is to just do an overview of what we know. What do we know in the literature about COVID and childhood cancer? I'm then going to share specifically with you some of our data from our research, our ongoing research studies, and then talk about what we can do. And then we'll end with an opportunity for discussion. I can share some resources with you and any questions that you might have. So I think we all know that COVID has not come without stress. I have felt it, and I can't imagine what it has been like for you as parents of with young children who have been undergoing treatment or survived cancer. Stress has come from school closures, loss of childcare, financial stresses for some of us, certainly disruptions to routine, fear and anxiety, and reduced social interactions. And I think it is the uncertainty of COVID that has caused the most stress, not knowing what it is, who gets it, how do we protect ourselves from it. And I think it has been interesting to see how our knowledge has really moved and shifted over time over the last 15 months as we have learned more. But I cannot imagine what it has been like for you during this time as well. So not only are we learning about this, whole new virus and what that means for the general population, but what does that mean specifically for your children, and what do we need to do, and how do we manage that? So I think the uncertainty has been for sure really, really challenging. So what do we know? We know in the general population, and I'm going to start there, that children are less likely than adults to get COVID-19. We know that the risk of severe COVID-19 disease in children is very low, although not absent. And we do have some evidence to suggest that children do not spread COVID-19 like adults. And so we think that child-to-child transmission is rare. I found this from sick kids who had been doing research looking at, I'm trying to pause this, but I can't do that. So I'll go back in a second. So sick kids have been doing research on looking at the mental health of children in the general population. And what they found was that over 70% of children, that's not with a chronic mental health condition, reported mental health difficulties. And what they found was the greatest stress of that was from social isolation as being the most significant risk factor for mental health problems. So I think that is really important data for us. I don't think surprising, but I think when we think about children involved with kids' cancer care, where social isolation has been a challenge before, and even more so now, how we might be worried about the mental health of children. I think it is also really not surprising to know that we have seen significant challenges in the mental health of patients. And again, this is just, in parents, and this is in the general population. This is not parents who have the compounded stress of having a child with a chronic health condition. Or cancer. And so I think we really need to be, and I think over the last 15 months, there has been increased attention to understanding that there are mental health challenges among parents, and these need to be addressed. What do we know about COVID-19 and childhood cancer? Well, we know that actually, which is interesting, that the risk of severe COVID-19 disease in children with cancer across the world remains quite low. There have been relatively few cases reported in the literature of severe COVID-19 cases and cancer. And I think the interesting thing about that is we have learned over time that COVID-19 affects the immune system, and for children undergoing active cancer treatment, their immune system is suppressed, and therefore there is no immune system for COVID-19 to interact with. So outside of actual, how COVID-19 may impact a child undergoing active treatment, we do know that there are impacts that have been felt as a result of the pandemic with respect to the need for prompt evaluation and diagnosis, the need for referral to tertiary centers, access to multidisciplinary subspecialized teams, timely and coordinated therapy, and access to supportive care. I think more recently, there have also been lots of questions about COVID-19 and vaccines, particularly in cancer patients. And I think there is, I think the rollout and the introduction of vaccines has been a really exciting time, but I think understandably for some families, there might be lots of questions too about my child has had a cancer diagnosis, are vaccines safe, and concerns or wondering about what to do. Obviously, trials for children under the age of 12 are still ongoing, and we're hopeful that those will come out soon. But for children over the age of 12, we certainly have evidence to support children getting the vaccine. So in March of last year, my research group at the University of Calgary launched a couple of studies, and we called these the COVID and Childhood Cancer Studies. And in fact, we launched 2 studies. One was really focused on COVID-19 and children diagnosed with cancer who were undergoing active cancer therapy. And one was focused more on the survivorship experience. And we thought that these were 2 distinct groups. They are, of course, distinct groups, but we thought the experiences might be quite different. And so we thought it was important to capture the experiences of these 2 different groups. Both of these studies were patient-directed, and so how this rolled out was actually I had a survivor, a childhood cancer survivor, who approached me in March and said, I am receiving all sorts of information. I don't know how to make sense of it. I'm not sure whether as a childhood cancer survivor I should be worried. And I'm wondering how the rest of my peers who are childhood cancer survivors are feeling. And if I am not clear on the guidelines and not clear on whether I'm, potentially more at risk, I wonder how my peers are doing. And I think it's important that we ask questions to find out. Similarly, I had a family approach me who were undergoing active therapy who said, this has been really tough on us. We used to be able to bring the family in for, when my child was undergoing treatments. Now it's only down to one of us. I've had treatments, appointments moved to online therapy or to virtual. I'm not sure how this is going to impact my care, and I am worried about how my community is feeling. So both of these came about from patients and family members who had questions. And this is how I like to do all of my research. I have not been in your shoes, and so for me to sit and decide on a research question that may or may not be relevant or may not be a priority it is meaningless if it doesn't come from yourselves. And so the fact that we had patients and family members approach us about the need to do this study was really important and told me that yes, this needed to happen. I also, at this point in time, because I wasn't sure about the literature, I wasn't sure how people were doing, I reached out to colleagues of mine from around the world to say, well, what is your experience like in Australia? What is your experience like in the US? What is your experience like in the UK? And we all came together to say, okay, let's try and pull together some questions and try and answer these questions. The recruitment for both these studies, because we were no longer allowed to, starting in March, I was no longer practicing in the hospital. We were all at home. We were not allowed to engage families for research face-to-face. And so we designed this to be a completely virtual study. And so we reached out to organizations such as Kids Cancer Care, to our patient partners and their networks and Facebook groups, as well as other research networks that we had to try and recruit individuals to be part of the study. So some of you may have seen this ad around the place. This was the ad that we had for our survivor study. We had a separate ad for our active treatment study. We had our whole questionnaire available online. So all you had to do was click on and answer questions. So I'm going to share first with you our active treatment data, and then I'm going to move into our survivorship data. So the aims of this study were to understand the experiences of families undergoing active cancer therapy amid COVID-19. And then really, given my background and interest, was to describe the mental health of children and parents undergoing active cancer therapy during COVID-19. As part of the questionnaires that we designed for this study, we had questionnaires or questions related to just your family's background as well as your cancer history. We had designed, because there was no existing questions for this, but some COVID-19 specific questions. And then we included some measures of well-being and distress. So here, who did we have participating? We had about just over 30 who participated in the active treatment study. The age of children was about 9 at the time of study completion, and the age of diagnosis was about 7. We had an equal split of male and female patients, and a mostly white population. So we asked parents, how has your care been affected by COVID? And specifically, we wanted to know whether their care had been affected or whether it had been delayed, modified, or canceled. And so there you can see that mental health care was probably has the highest frequency of being delayed, modified, or canceled, which was not surprising to me because I was told in March to stop seeing all patients, and that didn't resume until June or July that we had set up virtual capacity to see patients. 24% reported their outpatient clinic appointments had been delayed or modified. Some had 18% reported their in-hospital intensive in-hospital therapy had been delayed, modified, or canceled. And you can see there scans, blood work, chemotherapy, surgery. The only thing that did not seem impacted was radiation therapy. So lots of changes to therapies. We asked families how they felt about telemedicine because this was becoming more and more prevalent. And 65% of our active treatment families had said that actually they hadn't used telemedicine. They were still being seen in person. But more than 75. Almost 75% reported they found telemedicine beneficial or very beneficial, which is great news for me. And then if telemedicine is as effective as face-to-face, and a bit of a split there, about a quarter saying it's not at all as effective, but 75% saying it was somewhat as effective or effective compared to face-to-face. Again, because of my interests, we asked families, are you getting the psychosocial support you need? And actually 68% said yes, they were. And is your child getting the psychosocial support they need? And 76% said yes, they were. So then we asked parents to report, and they reported for themselves and their child, how is your current mental health compared to before the COVID-19 pandemic? And when you look at the orange bars for the child, you see that a small proportion reported it was much worse. Some reported it was somewhat worse, and the majority reported for their child it was about the same. When we looked at parents, you can see that obviously the most frequent response there was that it was somewhat worse, some reporting it was much worse, but the fewer reporting it was about the same. Because we weren't able to ask families, we didn't have sort of a pre-pandemic gauge of mental health, we thought the best way to ask this was how families felt their child's mental health was compared to family and friends. And in fact, the majority reported they thought their child's mental health was the same as family and friends. The next highest was saying that it was worse than family and friends. And a small group saying it was actually better than family and friends. We asked families what factors they felt had affected their child's mental health. And you can see here the majority here feelings of isolation from peers. And I think that's quite telling and consistent with the slide I showed earlier from the research done out of Sick Kids, looking at the mental health of children in general during the pandemic, and really showing that social isolation has been the leading driver of mental health challenges for children. Other responses, so tied to the cancer and their treatment, remote learning. So some interesting responses there of what might be contributing to mental health difficulties. When we asked parents, what factors have affected the mental health of parents of children on active cancer therapy? So the leading response there, your child's cancer and treatment, and uncertainty related to how COVID-19 might impact your child with cancer. Catching COVID-19 being high, uncertainty related to COVID-19, and other factors, boredom, feeling stuck at home were by far the majority responses. So then we asked, we had specific scales designed to assess anxiety and depression. And we looked at child anxiety and child depression. So the blue here is normal. So almost half of children undergoing active treatment reported within normal ranges for anxiety, 33% reported within normal ranges for depression. And then we had 6% reporting severe anxiety, 14% reporting severe depression. We asked the same questions of parents, and this looks a little bit different. So 30% of parents reported in the normal range for anxiety, 11% reporting severe anxiety, and 40% reporting some moderate anxiety symptoms. With respect to depression, more than 50% of parents reported normal depression, but still 9% reporting severe depression, 17% reporting moderate, and 20% reporting mild. So any surprises with these findings so far? Is this resonating for some of you?
In the chat box, we see that some parents, yes.
Okay. Okay.
Sounds pretty not surprising. When
Okay.
did this study end is a question we had, Fiona.
Yeah, so this study has been, we haven't actually officially ended it. We were hoping to get some higher numbers for this study in particular, but the data that I'm presenting to you today would have been probably up until February or March of this year. Okay.
I wonder if some people, when they answered the questions between like March last year and let's say, you know, that whole summer, those answers would be very different from the people who are like, okay, we see an ending because of vaccinations and stuff.
Absolutely. And we did want to try and have a bit of a defined time period so that, but even within that, we understood that across provinces, across countries, that restrictions were very different. So we did ask families when they completed this questionnaire, what restrictions were currently in place in their current where they were currently living. These were not just Calgary families. So we will be able to look at the data by kind of restrictions and you know, time of the pandemic for sure. So the next study that we did was to look at, for some reason it's not, oh, there we go, was to look at the experience for survivors. And the aims of this study were to understand the health beliefs of survivors of childhood cancer, to investigate the psychological impacts of the COVID-19 pandemic on survivors of childhood cancer and their parents, and to understand the health behaviors of survivors during this time. And so this was something that was a bit different from the active treatment study. We were really interested in how parents were coping and survivors were coping at this time. And I'll share some of that data as we go on. So this was the same format, same methodology as the first study. We asked about demographics and cancer history, specific COVID-19 questions, questions about well-being and distress, as well as health behaviors. Nikki, I forgot, we were going to maybe take a break.
How's everyone feeling? Give me a thumbs up to keep going or a thumbs down. You need to pee. If anyone needs to go to the washroom, feel free to just go. Okay, everyone's thumbs up. Okay, we're good to keep going, Fiona.
Great, sorry. Great.
I do have one quick question from another parent in the chat. I think it's a good time to ask. I know that we used to put the link into our MailChimp, so sent by Mackenzie Morowski, our nursing manager. She would send out upcoming program emails and your surveys were in there. Are those the same links that we could send to families if they wanted to help out with this study?
Yeah.
Okay. Okay.
Yeah.
They haven't changed. Okay.
Be great. Yeah. There were two different links, obviously, for the two different questionnaires. So, but I think that was on your website. So for this study, we had 157 survivors respond and 116 parents. We had a majority that were female. The age of this was quite a bit older. So the average age was 30. So these would be patients who were quite long off treatment. I will caveat though, today I'm going to share with you the parent data. I thought that would be most relevant to the audience. And so parents completed questionnaires for survivors who were 18 and younger. And so while that was the average age of the survivor cohort, the parent data reflects younger survivors. You see here the average age of diagnosis was almost 10. Reflected by the age. So some of these survivors were more than 19 years off treatment, a range of different treatments experienced. And this, as I mentioned, we were really trying to be international here. So we had a number of responses from the US, the UK, Canada, Ireland, and elsewhere. So we asked survivors, compared to your peers, what do you believe is your risk of severe complications from COVID-19 as a survivor of childhood cancer? And so just to remind everyone here, I think we haven't known. I think we have some data now on how cancer might interact with children undergoing active cancer treatment. But I think for those who've survived cancer, lots of questions about, well, we've received toxic therapy and we know we're at risk of other chronic health conditions. And so does that mean that we might be at risk of a more severe course of COVID? So I think we wanted to capture what people felt about that and what they thought their risks were. And so you can see here the majority reporting that they felt that their risk of severe complications were somewhat more or much more compared to their peers. What I thought was interesting too is we then asked, so there's a belief that there are greater risks, but then we asked, have you received information related to the risks? And 84% reported that no, they hadn't received any information. That's just what they believed and what they felt. So that for us was a real opportunity and a real place to potentially try and make a shift. We asked parents, so this again would be for some of the younger survivors, what do you believe is your child's risk of severe complications from COVID compared to peers? And here again, the majority reporting that the risk for their survivors was somewhat more or much more. Parents, had you received information related to the potential risks of COVID for survivors of childhood cancer? And 73% reported no, that they had not received any specific information. So same kind of pattern there. We asked survivors, compared to the COVID-19 pandemic, how would you say your mental health is now? The majority said it was about the same, but almost 40% said it was somewhat worse, and 5% reported it was somewhat worse. And how is your mental health compared to your family and friends? So almost 40% reported that they felt it was worse compared to their family and friends. 14% reported that they thought it was better. So we thought that was interesting.
I understand that, though. It makes sense because you're already conditioned to be in this sort of state of protection, right? So you're masking, you're sanitizing, you're doing all that. So yeah, I totally get that, and even affecting mental health on family and friends too, because they're just fresh into it. It's kind of like how we were at diagnosis, you know, that. But then you feel it again, and it's with COVID, but it's you kind of feel like I've been here. I know how to protect us. You know, you just put your shields up even more. But yeah, anyway, sorry.
No, so I appreciate. And so Trind, are you saying that you believe the better or the worse?
No, I believe that your mental health, or you can deal with the COVID, and then all of a sudden the masks and everything's happening, right? So everyone was really like, oh my God, like we're panicking. We have to isolate and we need to do this and keep our distance. And I'm saying, like, we were already, because we were in treatment, we were already conditioned to do those things. So I think the effect on your mental health that way, where it's so shocking and such a drastic change from your norm, right? Whereas for us, we weren't feeling that same shock because we were already in that protection mode.
Right.
Does that make sense?
Yeah. Yeah.
Yeah.
So we asked parents, compared to before the COVID-19 pandemic, how would you say your mental health is now? And 8% said they thought it was much worse. 45% said it was somewhat worse, but 42% said it was about the same, and some said it was somewhat better now. So that was interesting. We asked what factors are impacting your current mental health, and the two highest responses were fear about catching COVID-19 and worries about my past cancer and treatment. I think 50% also reported uncertainty related to the COVID-19 pandemic. So we asked here as well about anxiety and depression. So these were survivors' responses, and in these graphs, the blue is actually the kind of normal. I don't want to say the normal population, but based on data collected from the general population. So 70% in the general population would report no anxiety, and about 70% in the general population would report no depression. So you can see here that with the exception of the no anxiety, survivors are reporting higher levels of anxiety and higher levels of depression at each of those stages. Now, I will say this was a measure of anxiety and depression that we give to survivors outside of COVID. We didn't ask about whether this was related to COVID or whether this was just, you know, how you were feeling at the time, but I do think it's quite telling. we were also interested in, and Trindon, this might speak to your point a little bit, but we were interested in the idea of post-traumatic stress. And I think that was because one survivor that I had spent some time with actually found that the experience of needing to mask and needing to constantly sanitize brought back quite traumatic feelings for her following her cancer treatment. And so she felt that there was some really negative memories that was bringing back for her. So we wanted to ask about our survivors experiencing this. And while kind of almost 80% reported no, that they didn't have that experience, 20% did report yes, they did have that experience, and that's significantly higher than what we would see in the normal population or the general population. With respect to health behaviors, we asked, have you changed any change in physical activity since the start of the pandemic? 42% reported their change in physical activity had decreased. About 26% reported it stayed the same, and 30% had reported it had increased. We asked about change in alcohol consumption. And 50%, over 50% reported it had stayed the same, but 16% had reported that it had increased, and 12% had said it had actually decreased. We were also interested, based on our experience at Children's, we know that, that survivorship appointments have shifted to mostly online. That is changing slowly now, but we were interested in whether our experience was the same as other survivorship programs around the world. And 37 reported had said that their appointments had not been affected. 20% had said it had been postponed, 22% had said they had been held over the phone, and about 7% had said that they'd had some screening tests delayed. This graph here just shows where survivors are getting their follow-up appointments. So there's a range from survivors being seen in cancer survivor clinics to cancer centers with their primary care doctor and other. So as I said, we had noticed that there was a gap between the risks that survivors and their parents were feeling they might have with respect to COVID and the information that they had received. And so we developed, based on our data, and I'm getting the twirly wheel here for some reason on my computer. Oops, there we go. Oh. It's not liking this slide, for example. We had developed an infographic, and the idea was to try and condense the data that we had into visual images that could then be distributed to survivors to try and provide some information. And so we shared this over social media. Kids Cancer Care kindly shared this for us as well. It includes some of the data, but importantly, I think what we included here too were what can we do? And we had said that we know that survivors can experience higher rates of depression, anxiety, and post-traumatic stress, greater than the general population. And so here were some strategies to try and help deal with that. So what are the implications of this work? We know that there's a lack of information about risks. We know that this is impacting mental health, and we think we're seeing a change in health behaviors as a result of that. So what can we do? So I think it's important to talk to our kids about COVID. I know that at this stage now, they're all, you know, very well versed in wearing masks and knowing that COVID exists and knowing that this has significantly changed our lives. But I think it's always nice to check in with our kids, even though we make assumptions that, you know, they just get what's going on and we've been doing this. So it's sometimes nice to check in and just sort of see where they're at. What do they already know? Ask questions and follow their lead in terms of the questions that they're asking. Offer comfort to them and honesty. Help them feel in control, keep the conversation going, and I think most importantly, take care of yourselves. So what are the ways to talk to your kids about COVID-19? We really try to use age-appropriate language. So for children who are 3 to 6 years of age, there's a germ going around, which is making people sick. We know the best way to keep people safe is to wash our hands a lot. And guess what? The doctors say we could sing some songs while we do that. Older children and teens have more in-depth discussions about why it's important. Ask them why, you know, if COVID, you know, if they're feeling the stress of COVID-19, what does it mean for them if they've been remote learning? How is that impacting them? And I think that just opening the door for that conversation. I think there's common feelings that if we talk about it, that might help, that might work to increase our child's anxiety. And I think it's important to understand that no, that's not true. I think in fact, it does the opposite. So children, when they have, you know, hear of something happening, but they don't have all the information and all the details, they tend to fill in the blanks themselves if they're not given the information. So often when we can talk to them about their fears, and that can really help to reduce those fears. So we use the kind of term name it to tame it. Once worries are identified and discussed, and we can really name them, and you can help develop with your kids a concrete coping plan, then worries tend to decrease versus increase, and that's the taming it. How to help reduce your child's anxiety and worry about COVID-19. So here are some strategies that we know work in general about anxiety and worry in kids. Using the age-appropriate language is something that we know helps, and using coping-focused language. So we're doing everything we can to keep from getting sick. We encourage parents to avoid voicing emotional alarm in front of children, and avoid exposing children to alarming news coverage. So I know for myself, it has been really tempting to have the news on all the time. But when my kids were at home, trying to keep that to a minimum. Talking about how you are staying healthy, what you're doing as a family to make sure that you're doing the best you can. Certainly now talking about vaccines and how those are going to help us stay healthy, and reassuring your children that very few children have been sick, and if they have, their symptoms have been mild. I think as much as possible, sticking to regular activities and routines. And I know that has been really hard over the last 15 months, but I'm trying to keep consistency in the household as much as possible. I had just had my kids enrolled in soccer, and then soccer got shut down. And then I felt that it was worse to have enrolled them in soccer because they got a little taste of it and then it was taken away. But anyway, we're back in soccer tonight. So I think trying to keep some of that up as much as possible. How to know if your child is stressed. So this looks different at different ages and stages. So in young children, Disruptions in sleep or bad dreams, an increased need for closeness, fear of being alone, disruptive behavior, anger, or being emotionally sensitive and crying more than usual. In 6 to 12 years of age, shifts in sleep and nightmares, physical symptoms like headaches or stomach aches, withdrawal from family or friends, difficulties paying attention or focusing, again, the emotional sensitivity, and in some cases regressing to bedwetting or baby talk and irritability. In our teens, we look for, again, physical symptoms like headaches, changes in sleep or appetite, agitation, irritability, decreases in energy, or isolation from peers or withdrawal. I wanted to take a minute, and I'm coming to the end of the presentation, to talk about parent stress, because I don't think we talk about this enough. I can appreciate that you're stressed. Things that we know that promote coping in parents is maintaining routines, self-compassion, having realistic expectations for yourselves, trying to set time aside for yourself, and social support. I think mindfulness is another, is a great strategy. I know when I see some families at the hospital and I tell them that self-care is important, and I often hear back, well, I don't have time, and how can I do that? And, my child is sick, or, we've got so much on the go. And if I take that time for myself, it's taking time away from my child who needs me. And I think that if we're not gentle with ourselves and we're not giving ourselves that proper self-care, then in fact, we're less compassionate, we're less effective for our children. So I thought that we could do, I wanted to kind of lead us through this mindfulness activity. It's quick. It doesn't need to be, you don't need, an hour, but just to sometimes give yourself a moment or two of quiet. And so if you could now just sit where you are, and I want you to begin to notice around you what you can see, what you can hear, and what you can feel. And in your mind, I want you to say to yourself, I can see, and name any 5 objects around you that you can see. And then do the same with I can hear, and name 5 sounds that you can hear around you. And then I can feel, and name 5 physical feelings or sensations. And then you can repeat this sequence. I can see, I can hear, I can feel, looking for 4 objects, 4 sounds, 4 physical feelings or sensations. And then repeat the sequence again. 3 objects, 3 sounds, 3 physical feelings or sensations. And then repeat the sequence with 2 objects, 2 sounds, 2 physical feelings or sensations. And finally, one object you can see, one sound you can hear, and one physical feeling or sensation. And I think as much as possible, given all the uncertainty, all the stress, trying to remain present and just, we can't predict the future, we can't change the past, and trying to be as present as possible. I also think for all of you, you can't pour from an empty cup. So taking that time for self-care is not selfish, it's necessary. I've included some links here to resources. These are more, so there are guidelines that have been published by the Children's Oncology Group for those undergoing active treatment, as well as for those who, survivors, as well as the International Guideline Harmonization Group. And this is a collective body of international researchers who have come together to develop guidelines for what we know about who might be at risk for more severe courses of COVID-19, depending on treatment that you have received and chronic health conditions that you might be experiencing. So I would encourage you, if you have questions about your child's risk, to visit these guidelines, and they are very nicely laid out. Before I finish, I just, if you're interested in hearing more about what I do in terms of my research, we look at a few areas of research. We're interested in the social functioning of survivors, quality of life, the burden of symptoms, including the experiences of pain and sleep, and the mental health of survivors and their families. So please feel free to visit our website, or I will include my email at the end of this, and you're more than welcome to reach out to me. So in conclusion, I think we are still learning about COVID-19. We know a lot more now than we did before, but I think things are ever changing. And certainly as vaccines roll out, we will be learning more about what role vaccines are going to play and what that's going to look like. We believe that information about who is at risk and, more importantly, what can be done is really important to improve stress. And so we've been trying to share that knowledge as much as possible. We know that children can experience stress related to changes and shifts in their environment as a result of COVID-19. Coping strategies and support from parents can help buffer these impacts, and parent stress reduction and self-care are important priorities. I just want to thank my research team, to any of you who may have participated or plan to participate. A huge thank you to Kids Cancer Care, who have promoted the study, and for inviting me to come and speak to you. And yeah.